Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program, heard from 7 to 7:30 each Saturday, right here on WSBR 740 AM, is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Oh, it is a good morning.
It's a beautiful morning. The sun is coming up.
Oh, yeah, I saw the sunset.
Oh, my God, so much rain yesterday.
Sunrise. Rain.
God.
But you know, California needs it. We've got to push it over there to California.
Yeah, Florida, we had enough for the summer.
Well, it's okay. It's only if you have a dog is it hard in the rain because your dog
I'm the
needs
dog.
to go. Oh, you're the dog. Well, Dr. Mencia, you brought in a wonderful woman this morning to our radio show.
A good friend of yours.
Yeah, this is, she walked in, I said, oh my gosh, I didn't know we had this other person on now, because sometimes we get mixed up, they book the wrong person. And I was going to say, listen, Dr. Mencia, this is his time, what are you doing here? Why don't you introduce her?
Yeah, Susan Robertson.
Good morning.
Good morning, Susan. Welcome to the show.
Thank you so much.
And she worked with Heartland. So tell us a little bit about your company.
Just a little bit about Heartland. Oh, my goodness. So Anita and I met...
In 30 seconds or less. No,
in 30 seconds or less. I can do that. Anita and I met a lot of years ago when I was working with our skilled nursing facilities, and that's still a big part of our company's business. But right now I'm very proud to be able to be a part of our hospice division, and such a needed service with many, many misperceptions and misunderstandings about what hospice services can provide for a patient and their families, and we just want to be a part of the community and help get the word out there and help people understand there really are benefits out there for them when they're struggling.
That's one of the things that I miss with the way, in geriatric medicine now, they are trying to push so many geriatricians quickly that when I did my training, it used to be a 2-year program. Now it's a 1-year program, so they get geriatricians to come out on the workforce much faster. And when I did my training, we have to do hospice training. And it's so important for physicians to have some sort of training on hospice and the negative connotation of what hospice is all about. I think hospice is a beautiful thing. It's a great thing.
I would like one clarification for people who are listening at home. It used to be when they thought they went into hospice, there was a building. They had to go. It was like a hospital, and there are a few like that where you go in. But I know differently, and Susan, why don't you tell us that hospice can be in your own home, it can be in wherever you are. So I think that's a myth, right?
Correct. And you are so on target, Anita. We want to make sure that people understand that hospice is not a place that you go to receive services. Hospice for us really is a philosophy of taking care of, helping to support, providing resource and comfort, and what we call palliative services. We do a lot of medically complex services wherever the patient is calling home. So that can be in their home, as you said. It could be in an apartment. It could be in an assisted living. It
could be in a hospital.
It could be in the hospital,
yeah.
Absolutely.
That's happening a lot.
Yes. Yeah.
Wherever it is that they are at with their disease state or what is going on with them is where we want to be to help them.
I personally have 2 instances. My father was in the hospital as a patient, and then they said that it was just not going to work anymore, and then they just moved him to a different location in the hospital, which was hospice. My mother was at home being cared for, and the doctor came in and he said, we need to get her to hospice, and it was a hospice by the sea. So, you're right. That's why I'm really so onto this. And so, Dr. Mencia, when you have a patient, what point do you say to that patient, I think you need to be in hospice?
That's such a great question. That's a wonderful question, because lots of time, family and physician, they wait so long before they put a patient in hospice. And in my point of view, I like to, if I have a patient with, let's say, emphysema, very advanced, which was one of the cases not too far ago. And the patient said, look, every time I'm coughing and I get a little shortness of breath, they're taking me back to the hospital. I'm tired of this. I don't want to do that no more. I want you to keep me comfortable. I say, okay, I think it's time for you to go, let's go hospice. They say, you think I'm that advanced? I say, we don't know, but if I want the hospice people that are going to work with us, in your case, to meet you, I want them to meet you now that you can talk and you can still walk and you can express your wishes so that they don't see you when you are now bedbound, that you are so advanced you can, you cannot even communicate with the people taking care of you. And he was so appreciative. He said, oh, that makes so much sense. I said, I want them to meet the patient that you are. I want them to meet the person you are right now.
That was well said.
And he went into hospice, and he lasted for about 8 months. But he was never hospitalized. All his wishes were being attended to and respected. And that was so important because when it came to the kids, they have different wishes. And we were able to say, no, this is what your father wants, and this is what we're going to do. We're going to respect those wishes. Oh, no, but I was living in California, and I just came, and we shouldn't do that. Can we put him in the hospital to make him better? That's not what he wants. So we have to respect that. So hospice is the time that we can call hospice. You can call hospice at any time. In my book, I like to do it early. And sometimes hospice will come in and they will get to know you. Like if I call Susan to come and see a patient of mine, they will come in, get to know the patient, and say, well, you are not ready, but at least we know each other. And when the time comes that you feel that we are ready, then she'll bring her staff and we things into place.
So, Susan, what part do you play in the whole hospice scenario at your organization?
So we do everything from, as Dr. Mencia noted, coming in what we like to do earlier rather than later to help start the discussions. With Dr. Mencia, we don't have to do that because he's so good at doing that. But a lot of physicians don't understand that, like Dr. Mencia does, that talking to a patient and their family sooner rather than later really does help the family, the patient, get their wishes known, get them on the same page in terms of identifying what do I really want to have happen, and having those discussions. And a lot of times families can't do that on their own. So we can play a role in that and doing a lot of hand-holding, helping identify the different types of services and what kind of treatments that patients want to have or do not want to have, and then walking them through that all the way up to the actual signing on of hospice and providing those services. So now a family can go from having little to no support at home to having access routinely to an RN, access routinely to spiritual care if that's what they want to have coming into their home, access to the physician that they've known for years and years and years and have been taking care of them and are still involved in that, and making the decisions with them as they go, helping them to make decisions about, do I want a DNR and what does that really mean? Do I want advanced directives, and what do those advanced directives look like? Bringing in the pet therapist, because it just brings joy and pleasure to this patient who doesn't have access to that anymore, enjoyed that for years and years. Having the music therapist come because they loved to play the piano years ago and just can't do it anymore and want to hear that beautiful sound, a few more times. It's all those things that we take for granted day in and day out that truly brings quality to our life, and we want to bring that to the patients that we take care of.
It's like I was talking to a patient of mine, Susan, with an enlarged heart, and we were talking about hospice. And basically he will get on the phone trying to talk to the kids, and he will get shortness of breath, and he smiled too hard, and he will get water, fluid in his lungs with congestive heart failure and what have you. So it was very advanced, and I say, I think we want to call hospice so we can work on keeping you comfortable And he said, Dr. Mencia, does that mean you are throwing the towel? And this guy, he used to love to go on cruises. And I say, remember when you go on a cruise, how they take the towel and they mold it into an elephant and a snake? So we are not throwing the towel, we're just molding the towel to your wishes. So we want to keep you comfortable. We want to do things for you so that we keep working. So your wishes are all there. We're going to now start searching for what makes you happy.
This is very important that we're talking about this, because as you were saying that, I think I've heard this from people when I've said, well, are you going to call hospice? And they look at me, absolutely not. If my father thought we were going to hospice, he would give up. I mean, and I know that's the biggest problem, that people see it as a death sign, that, okay, you're dying, and so it takes a physician like you, Dr. Mencia, or someone like you, Susan, who can really explain what it is. So, Dr. Mencia is my doctor, and he knows a lot about me, and I know a lot about him, but one thing he probably doesn't know. I'm catching him. I was going to have, many, many years ago, hospice was going to be on my radio show. I think it was one of the organizations up in West Palm. But they said, before we come on your show, we want you to come to see what we do. And we want you to have a tour. Now, it's very private. Each person that they're dealing with is a private thing. But I sat in on a meeting. I had to swear, my blood. They had the doctor. They had the psychologist, the social worker. They had the whole team. And I never understood that. And this particular was a very interesting aspect. The person who was in hospice at the time that they were discussing was eventually going to probably bleed from something. And they talked about having black towels so that the white towels did not scare the caregiver. I mean, things like that. And I learned a lot about hospice from a different perspective. See, you didn't know.
I never thought of that.
No.
Absolutely. Yeah.
I mean, but they had it down, but just like you said. And then I've had them on my show where I've had the musician come on, the therapist. The music therapist came on, sang on the show with his guitar. And
bring the horse.
Yeah, and the horse, I have told people that there is a horse. No, I told the story that up in one of the hospice facilities, a man was dying, and the one last request was he was a horseman, and he wanted to see his horse. Nothing would do it. They did transported the horse so he could have it in his room to see it.
That's terrific.
I mean, talk about what they don't do, right?
The elephant in the room.
Thank goodness there was a horse, not an elephant, right? But isn't that a problem that you do get, Dr. Mencia? And you were expressing that you have to take a deep breath and say, we're going to call in hospice, but they have to really realize that there are people who get hospice and then they get well.
That's
they get better.
I was going to say that. Hospice is not a death sentence. People go into hospice to follow the philosophy of care of hospice. But if the person start getting better, start improving, quality of life is getting better, their condition is getting better, you get to a point that hospice say, okay, Dr. Mencia, your patient is back, we are out, and they go away. And, so it's because you go into hospice doesn't mean, that you cannot come out of hospice, and they are the first one to tell you, this person is doing so well that you really don't need us right now, and they pull back.
Have you seen that, Susan?
We do, and I think the really terrific thing about that is helping. If we've done a good job of explaining what our services can do for a patient, sometimes one of the greatest joys that comes out of what we do is seeing a patient really excel, because now they do have all that attention and the attention to the detail that they may not be able to do at home by themselves. And now they have somebody coming in helping make sure that this treatment is happening and these medications are being taken the way the medications need to be taken. And I think just the whole psychosocial thing and the dynamic changes, and that's really a credit to all the hospice primary care givers, because they have hearts of gold, and they are not going in, throwing in the towel or giving up. They're going in to do whatever they
to mold that tower.
That's right.
To mold
their
the
patient needs to have done. So when we do what we call live discharge somebody, we do return them back to here's what's going on. But I think I want to make sure that people understand just because somebody gets better and we take them off of our services does not mean that we say bye-bye
walk away.
and we never
Right.
come back.
Right.
We do have a very intense process where we stay in touch with them. You know, they're family now. You know, once you join Heartland, you don't leave Heartland, one way or another. So for us, it's that routine call. How's it going? You know, is everything still okay? Have you seen your doctor recently? Is there anything that you feel is different? Is there anything that's changed for you? Should we make an appointment for you to go see your doctor if you haven't been in for a while? Because we do want them to have a quality of life, whether they're with us or not with us. We want that to continue. And when that inevitable decline comes again or something changes, we want to be right there sooner rather than later, so that they don't feel pain, that they are comfortable, and they are enjoying what part of their life they still have. So that's important for us when we do. But we love being able to say, hey, you're a graduate.
Yeah.
When you think of it, but hospice, of course, is a part of the physician, too. I mean, like Dr. Mencia never lets go of you. And if you're in hospice, I mean, he is working with the hospice people, and they're working. And so knowing Dr. Mencia as I do, I think that this is really quite good for some people. And let's talk financially. The Medicare, I mean, the government has some fantastic programs. We have Social Security, but this is something they pay for,
Yeah,
correct?
Absolutely.
And so Dr. Mencia is there making sure, so if you need things that you can't get because you don't have the money with certain kinds of care, and you can get on hospice, it's a savings to them. It's a blessing to them.
Absolutely. Because when hospice step in, Heartland will go ahead and bring whatever the person need to be comfortable. Name it a hospital bed, a Hoyer lift, whatever it takes to get that person well taken care of.
And do you spend time, Dr. Mencia, you know, as the physician, talking to the family, explaining it to them also?
Absolutely.
Because I don't think
yes.
Susan's always there. I mean, she can't be in every doctor's offices.
Right.
But you, and I know you do a lot of education. I hope that you do this with some of the doctors too, and you teach them.
I do.
I hope so.
You know, I lecture nationwide to physicians. I'm an educator, so I usually like to bring up hospice when I'm talking about polypharmacy, because I get so many patients. I remember one that I have about probably 14, 15 years ago, and the son is a very famous judge in Broward. And he brought his mom in.
I know you told me this story. Go ahead.
And she was taking 28 pills. And I said, well, you know, she was so declined and what have you. And I said, let's do comfort care. And he said, don't talk to me about hospice. I said, okay, why don't we do comfort care? I can do it without the name hospice. And he agreed with me to just continue with the medication that were essential for her. So we don't want to speed up her process of dying, but let's make her comfortable. So we left her on 6 pills. And the judge he looked at me, young physician with a ponytail, and he said, are you sure? Are you sure you know what you're doing, Dr. Mencia? I don't mean to offend you. And I say, I want to say, no, I'm not sure. I say, I think I am. We can always go back and add more pills. But I think if we leave the essential medication, you know, at least we're going to be able to see your real mother. And he sent me a big basket of fruits, and with a note say, thank you for returning my mother to me. Because she lit up and she was so much better. So it was a functional decline that was all drug induced. So sometimes a person can have a functional decline because of terminal illness. But sometimes, you know, when the hospice personnel come in, you have that team approach, which is what we do in the office. We have that team approach also. The hospice is very much like us. They have that team approach where religion is being attended to, music is being, the biopsychosocial aspect of a terminal illness is being attended to. So the person is being looked at, not only the disease. And that's beautiful. And, the lady did come out of hospice eventually, and she continued to live. And then we did a CAT scan, and what she had also was a hydrocephalus, normal pressure hydrocephalus. So we took her to the hospital, we did a shunt, and in a year or two, she was vacationing in Spain.
Wow.
What a change. So we mold the tower. That's what that's what this is all about. It's not throwing the tower. It's just molding the tower to say, what is it that we can do to bring comfort to that person.
Susan, I would dare say this would be very rare for you to find other doctors who are so secure and understand this as well as Dr. Mencia.
We are, like I said to you earlier, we are very blessed to have Dr. Mencia that we get to work with, and he is a jewel when it comes to looking at, the total picture of the patient.
Thank you.
And what is good for them, up to and including hospice. And he has such a great understanding of what a hospice benefit can be to a patient. And so, part of my mission is to help other physicians understand that same thing, and that they do play an important role. And I also understand, too, that sometimes physicians have a really hard time with dealing with this aspect, and that's okay. It's very okay. And so we can be there to kind of help fill that gap where there is not comfort there. And a lot of times I have seen physicians who, and I have total respect for what physicians do, because it's not an easy job for them. And, I've had a physician who said to me, I'm just so attached to my patient, I don't want anything bad to ever happen to them. And that touches me very deeply, because that means that physician really does care about what's going on with their patient. And so
now you have to give him Dr. Mencia's phone number.
That's right. Yes. So it's like, please call this doctor.
He'll explain it to you.
And then let me talk to you about what your care and concern for this patient is doing to them in terms of the things that they could be having that they're not having. And the other thing that I think a lot of physicians miss out on, and Dr. Mencia so doesn't, is the whole concept of the caregivers and that whole end of taking care of a loved one at home who is dealing with a terminal illness and wanting to keep them there, and what happens potentially to that caregiver. There's a high rate of burnout on their end. They become ill. They have a lot of issues to deal with. So hospice can kind of take care of both the patient and the family and get them to a good place.
Susan, what's your website if people want to look at that?
Absolutely. So the direct link is hcr-manorcare.com, and then you just go in and put either a state or a zip code for a city, and you can pull it up to the area that you're looking for, and then pull up hospice. And very soon we are actually going to have direct web links to our hospice agency. So it'll give updates on what are the different types of services that we provide, what are special events that we're going to be doing. We do a lot of fundraising. We do a lot of community-oriented services, so it'll be there too.
I have to give Dr. Mencia's phone number. Everyone who listens, of course, knows that they're open on Saturdays, which is unique to begin with.
And we do the home visit.
Yeah, and that's why this is so important too, the home visit, which many people might be on hospice, and they are at home, and very few doctors do home visits, but this is a perfect reason why you want to call Dr. Mencia's office, the Adult and Geriatric Medical Center, and its number is 954-489-1345. 954-489-1345. And I have a solution for you, Susan. We have to go and maybe we have a new business. We're going to get little ponytails with little clips on it. You're going to give them to all your doctors so that they can be...
Join the Mencia family.
That's right. The fashion plate, Dr. Mencia.
And then we're going to give him a towel.
Oh, yeah.
Start molding.
The towel also. A black towel.
Yeah.
But
or red or white.
Yeah, that's right. Not white. We don't want white. Yeah. Anyway, but it's really important. I'm so happy that Dr. Mencia brought you with him this morning. I haven't seen you in a long time. And your organization is really first class. I know Heartland used to be Manor Care. Maybe it still is.
It is.
But Heartland is a different, and it's the heart, the Heartland. Mm-hmm. I love the name. So it's great, and it's wonderful to have you here. Susan Robertson, Marketing Manager for Heartland, and it's their logo is Enriching Life. And that's what we all want to do for our elders.
Absolutely.
We want to do it for everybody, but Dr. Mencia does it especially well.
At all stages of life. That's
yeah,
what we
all stages of life. That's right. But
when it comes to hospice, because when a person is at home, and we send a visiting nurse. The visiting nurse will spend a few minutes and then go. When it comes to hospice, how much care do the person get?
However much care they need.
Not 24 hours.
We don't do 24-hour care and services, but we're available to them via 24/7. It's from the community to come in. And get what they need.
Yeah. Well, we certainly thank you very much.
Susan,
it's been wonderful.
Thank you for coming.
My pleasure. Thank you.
It's always over too soon, but Dr. Mencia is such a joy. We all wait patiently for him. I especially wait for him. Whenever he calls, he's going to be out of town. I said, no way, you can't leave. Anyway, thank you so much. And we're going to just take a break. We're going to go to Joe Carper, elder law attorney, who knows all about hospice because so many of his patients wind up there. So we'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.